This 42-year-old gentleman from Iraq, he came in with complaints of pain in both the hips. Diagnosing, we found out that he had got avascular necrosis of both the hips, in which is the blood supply of the head of the femur was damaged. So, if I can explain that, this would be your hip, and this is the ball, and this is the cup of the joint. Now, what happened in this case was the blood supply to this part of the joint was damaged or compromised due to history of steroid intakes. Because of that, his hip had become arthritic and become very painful to the extent that he was not even able to walk a few steps. To complicate matters further, that he was morbidly obese. He was weighing almost 180 kgs, and he had a number of medical comorbidities like diabetes, like chronic obstructive pulmonary disease. He also had obstructive sleep apnea because of which he was barely able to lie down straight, and all of that was complicating his medical management. So in this case, we had to actually go for a multidisciplinary, multi-team effort in which consultants from various specialities like diabetology, internal medicine, respiratory medicine, anesthesia, and all of them got together. So what our plan was to manage the medical conditions and then make him fit enough for a surgery. The surgery which we planned in his case was a hip replacement. Now it was done on both the sides at a gap of around 15 days, after which he was able to stand and walk normally. And post surgery, he's making a very good recovery, and he's had a lot of difference to his lifestyle, to his overall activities of his daily living that he's able to perform, and he's very happy after the surgery.